Okay, my name is Holly Zomar-Davis, and I'm going to be doing my nf3 skill number 2 redo for my lab assessment. So I have all my papers here with no writing on them. Quickly look over. Here's my dressing with the patient's number and my drain. Barely has fluid in it. There. That's the cowbell. And all my supplies. I'll do a quick 360 of the room. These books are just to hold up my stand. Okay. Okay, so my procedure today is you are the practical nurse learner caring for Deep Stevens. Deep was admitted to your unit following abdominal surgery and chest tube insertion. The time is 1400 and Deep's laparotomy incision and drain dressing is due to be changed and drain to be emptied. Okay, so I'll set that aside and we'll go over the doctor's orders. So Deep Stevens is a male. His hospital number is 1002 45629. Date of birth, November 29th, 1980. His doctor is Dr. Ball, and the admitting diagnosis is penetrating abdominal trauma and a pneumothorax. Visit reason is he was in a mountain bike accident, got thrown over the handlebars and landed on a tree stump. Surgical procedures to date are laparotomy, penetrating wound debridement, chest tube insertion 6 days ago. Deep has no known allergies, which is important because we're going to be using a solution to cleanse the sites. His goals of care designation are R1. So I know we see that he's on lots of medications for the pain, so that's good. We're doing the abdominal drain. The action is to empty the drain every 8 hours and as per needed. The abdominal drain dressing action is to cleanse drain insertion site with 0.9% sodium chloride and apply a sterile dressing daily and as per needed. And then the abdominal laparotomy dressing the action is to cleanse incision site with 0.9% sodium chloride and apply sterile dressing daily and as per needed. So I'll do my first saline check. Okay, so here I have 500 milliliters of 0.9% sodium chloride. It expires 2023. It is clear. There's no particles in the water. It has not been opened yet. And the abdominal drain dressing requires 0.9% sodium chloride, and the abdominal laparotomy requires 0.9% sodium chloride. So we know that this is the right solution and it's good to use. And then I'll go over my supplies. So I have a sterile dressing tray. Let's do hand hygiene. So I have my sterile dressing tray. It has been opened, but for lab purposes, it's dry and intact. It's good to use. There's no expiration date on this. I have my drainage container. I have some pre-cut tape, and then I have some scissors and extra tape if I need it. My alcohol swabs. I have 2 2x2s. There's no expiry date on them, but they're both dry and intact, so they're good to use. I have 2 4x4 gauze sponges. They're dry and intact, both of them. And this one expires 2025, and this one expires 2025, so they're good to use. And then this is my my tea sponges. There's no expiration date on them. They're dry and intact, they're good to use. Here I have my sterile gloves. They're dry and intact for lab purposes. I have opened them before, but for lab purposes, they're dry and intact. And their expiration date is 2022, so they're good to use. And then I have my drape and I have some gloves. I also have a garbage can and the call bell, but we'll worry about that when we get in the room. So I'll do my second saline check. So here I have 500 milliliters of 0.9% sodium chloride. It expires 2023. The fluid is not cloudy and there's no particles, and it has not been opened. The abdominal dressing requires 0.9% sodium chloride, and the laparotomy dressing requires 0.9% clodium for 0.9% sodium chloride for cleansing both wounds. So I know that I have the right solution. It's good to use. Okay, so I will gather up all my supplies and head into Deep's room. So all this I'll just transfer and bring with me. Knock, knock. Hand hygiene. Hi, Deep. How are you doing today? He says good, and I say that's good. My name's Holly. I'm going to be your practical nurse learner today, and I'm here to do your laparotomy incision dressing and your drain dressing. Is that okay with you? And he says yes, so that's confirmed. We can go ahead with the procedure. So Deep, could you please tell me your birthday? He tells me November 29th, 1980, and I'll just go ahead and check his number. So 100 100 245 245 629 629. So I know that I have the right patient, which is important. Deep, are you experiencing any pain in your incision site? He says not terrible. It's bearable. We can do the dressing. So I will go ahead, and now that we're in the room, I'm going to do my third saline check. So here I have 500 milliliters of 0.9% sodium chloride. It expires 2023. The contents are clear, no particles floating around, and it has not been opened yet. For the abdominal drain dressing, it's to be cleansed with 0.9% sodium chloride, and the abdominal laparotomy dressing, the incision site is to be cleansed with 0.9% sodium chloride. So I know that I have the right solution, and we can go ahead and assess Deep. So I'll do hand hygiene before I put on my gloves until it's dry. So Deep, is it okay if you just lift your side for me while I slide the drape underneath you? He says yes, so I'll just move the drain out of the way and put them on here. Great. Thank you so much. So, is it okay if I take the dressing off? He says yes. So, how I remove, also, when I enter the room, the bed is in the lowest position, bed brakes are on, and one bed rail is up. And before I start working on Deep, I will move the bed to working height, which will be waist level. And then to take off the incision or the dressing, I'll peel the tape towards me. And looking at the dressing from the outside, I can see that there is no shadowing. So I won't have to document that. And then the date it was last changed was yesterday at 1400. So it's 24 hours and it's due to be changed. Okay. So just need to separate the tape here. Sorry, Deep. If it's too uncomfortable, just let me know, okay? He says okay. And then his head is up here, so what I'm going to do is I'm going to take the dressing and peel it away from his face so that he can't see what's underneath. Okay. So I'll take that, and then I'll sneak my tea sponges. Thank you very much, Deep. So I'll just show the camera here. The tea sponges are we're gonna be doing our taco assessment. So type would be serosanguinous. Amount would be about, I'd say 10 to 20%, 10%. It's red and there's no odor. This one I'd say maybe 5% of serosanguinous, red, no odor. And again, maybe 5 to 10% serosanguinous, red, with no odor. Okay, so now that we've done that, I'll just ball it up, and I'm going to take my gloves off and I'm going to throw this into the garbage. What I'm going to do is also put on another pair of gloves because I want to tape the drain up. While I'm taping the drain up, I'm going to assess the incision site for redness, edema, ecchymosis, the drainage, and approximation. So we'll just take off a little slice here. And I see no redness, no edema, no ecchymosis. And I'll just get that out of the way, but it'll be easier for when I put the bandaging back on. So again, yeah, no redness, no edema, no ecchymosis. The drainage was serosanguinous. There's not too much on here, but we'll get that cleaned right up. There is 6 suture sites on the laparotomy incision, and then there's one suture holding in the drain. So we're going to go ahead, if you're okay, and start setting up. Deep, he says that's okay. May I put the garbage on your bed? He says yes, so I'll put it right there and get my doctor's orders out of the way. So I'm going to do some hand hygiene and set everything up. I'll also move these gloves out of the way so that everything else is visible. Okay, and because I touched all that stuff, I'm just gonna hand hygiene again. Never go wrong. Okay, to open my dressing tray, I'm going to peel towards myself so as not to contaminate. And I'll just set it down carefully so that I can throw this in the garbage. Okay. So what I'm going to do is grab my forceps from the corner and find the corner of my dressing. Lay it down. Okay, so I'll get rid of this. Just throw it into my garbage. I'll put my forceps down, keeping in mind the 1-inch barrier here. Okay. Now I'm going to get my gauzes ready. So I'll just push my sterile tray forward. And I'm going to open my gauzes to which ones I don't need first. So my tea sponges I'm going to use last. No, but that's okay. They're already open. So I'll open them just like this. Grab my forceps. And I'll create a window for myself to go through. And place them at an angle so I keep in mind what I've contaminated from putting my hands over. My 4x4s. that 2x2 is contaminated by touching my window. So I will not be using that 2x2, but I will still be able to use my 4x4s. And I don't need my forceps anymore, so I'm just going to take the 2x2 out of there completely. So now I can go ahead and pour my saline. I'll do hand hygiene. Push this forward until I'm ready to use it. And get my sterile gloves. So I'm going to do hand hygiene. And I open my gloves. So I start by grabbing the inside of the right hand glove first. Okay, so I'm now sterile. So I have to grab the inside of the cuff on left hand. And keep my thumb out. Oops. Okay, so I'm now sterile, and what I'm going to do here is grab the inside of my tray and move it inside of my tray, and I'll just right like that. And I'm going to put it right here. And I can start cleansing the wound. So as soon as my forceps get wet, my metal forceps, I want to make sure that the tips go down. So I'm just going to place all of my 2x2 gauze in here, and I'll grab this extra one. And I'm going to cleanse from clean to dirty. So I start from the middle of the incision and swipe down, discard. And go from the outside, discard. And again on the outside, discard. Now I'll clean the drain site. Okay, so I'll do one pass on the outside, discard, and I'll work my way in towards the middle. Discard. So now I want to use this one to cleanse my drain from the underneath. Discard. And I'll do one more swipe on the drain. Discard. Okay, so now I will drop the forceps. I don't need them. And I will wait for the incision site to dry fully, as well as the incision site. I could pat them dry, but I'll just wait for them to dry. Okay, so it looks like they're dry enough. And what I'm going to do is I'm going to take my 4x4s and I'm just going to place them inside my sterile tray. And I'll grab my 1 tea sponge. And what I want to do is place it away from where the drain is going to land. So, just like that. And I'll take my other one, and what I'll do is set it up so that it's opposite from the other one. Okay, now I can top it with a 4x4. And the other 4x4 I'll put on here, and my last one I'll just place there. So now everything that needs to be sterile is sterile. What I'm going to do is take my tape off so that it can rest properly under the drain. And I start taping. While I'm taping, I will teach Deep my 3 patient teachings, which will include infection signs. So Deep, if your incision gets itchy or starts getting really painful, or you see some red streaking, let one of us nurses know right away. If you feel feverish. I'll also teach Deep about the integrity of his bandage. So ensure that the bandage does not get wet, and if it does, let one of us know right away as nurses so that we can redress it for you. And then also, if it gets really painful, just let one of us know so we can come give you some medication to help ease the pain. So, can you repeat back what I had just told you? And Deep repeats it back to me, so I know that he has understanding of the patient teachings. And I want 1 inch border of tape around the dressing site. Also also Deep, if your drain starts to get really full, let us know so that we can assess that for you right away. Okay. So on my last piece of tape, I'm going to date it, time it, and I'm just gonna wait until I have my gloves off because I have to get my pen out of my pocket. Okay, so I'll set this here so I don't forget it, and we're going to empty the drain. So obviously in real practice I wouldn't use the drain, a container that has blood in it, but this is the only container I have, and for lab purposes it's okay to use. So I'm gonna get ready my alcohol swab, and then I will open the drain away from me. And pour it in. Okay, and for my swabbing, I will put this on. I'll squeeze my drain, and then swab. And close it. And now it's reset. So it's squeezed. And now I can assess my drainage. So, I have approximately 5 milliliters. I wonder if that's too close. Approximately 5 milliliters of serosanguinous red drainage. It has had no odor when I was pouring it, and it's pretty thin, pretty movable. So I'll just take that, set it over there, and I'll put all my supplies away. I'll put Deep's bed in the lowest position, ensure the bed brakes are on. He's got his call bell. Clean up all my garbage. Check my tape. Now we'll go in the garbage. Sterile field. We'll go in the garbage. Take my gloves off. Actually, sorry, Deep, I'm just gonna lift you up. He says it's okay. Throw this in the garbage. Take my garbage off. Take my gloves off. Hand hygiene. Okay, now I can write the date, 2021, August 16th, 1400, and sign off my initials. Drop that right on there. And now I can hand hygiene and leave Deep's room with everything included. I'm just going to quickly show the date. Here we go.